Hey nurse family! Welcome to Crash Course Pharmacology with Nurse Jane. Today we're tackling one of the coolest cats in the cardiac drug classes, calcium channel blockers, or as I like to call them, the chill pills for the heart and vessels. Alright friends, let's dig into the why behind the what. To understand how calcium channel blockers work, we need to peek inside your cells, especially the cardiac myocytes and vascular smooth muscle cells. So buckle up, let's take a microscopic trip. Think of calcium like a key that unlocks muscle contraction. Let's look at how calcium works in the heart first. An electrical impulse travels through the heart's conduction system. Hello SA and AV nodes. This impulse opens L-type calcium channels on the cardiac cell membrane. Calcium rushes in, triggering the release of more calcium from the sarcoplasmic reticulum inside the cell. When calcium attaches to those receptors, even more calcium is released. This is called calcium-induced calcium release. Weird, am I right? All that calcium binds to troponin. This allows actin and myosin fibers to slide back and forth across each other. The stronger the contraction, the harder the heart beats. This leads to increased cardiac output and increased blood pressure. Calcium also works in the blood vessels. Smooth muscle cells and vessel walls also rely on calcium. Calcium entry leads to vasoconstriction, narrowing of the arteries, and higher blood pressure. Less calcium means relaxed vessels, which equals lower pressure. So where do calcium channel blockers come in? Well, calcium channel blockers block those L-type calcium channels, meaning less calcium gets in. This means less contraction in the heart, relaxed and widened blood vessels, and ultimately, lower blood pressure. Okay, let's break it down a little further. Calcium is like that overly enthusiastic friend at the party. It helps heart and muscle cells contract. But sometimes, we need to calm things down. That's where calcium channel blockers, sometimes we just call them CCBs, come in. So too much calcium means high pressure, angina, and arrhythmias. If we block some of that calcium from attaching to the receptors, the heart and vessels can finally chill. There are two types of calcium channel blockers. Let's meet them. Dihydropyridines. Remember these as being dippy. They dip into the vessels and relax them. Examples of these are amlodipine, nifedipine, and felodipine. The effect? Well, they mainly dilate blood vessels, which lowers blood pressure. Here are some things to be aware of. Watch out for reflex tachycardia and peripheral edema. Reflex tachycardia is when the heart speeds up in panic in response to lower blood pressure. It thinks it needs to compensate by beating faster to maintain cardiac output. Then there is peripheral edema, or you can think of it as leaky legs. Why does this happen? So, calcium channel blockers dilate arterioles, which are the small arteries going into the capillaries, more than they dilate veins. This actually increases hydrostatic pressure in the capillary beds. With all that pressure, the vessels leak fluid and it gets pushed into the tissues. The result? Swelling, especially in the feet, ankles, and lower legs. Nursing tips. Assess for edema regularly. Elevate legs and consider dosage adjustment if needed. Just remember, this isn't due to fluid overload, so diuretics often don't help much. The other types are the non-dihydropyridines. We refer to these as being not dippy. They only chill out the heart. They don't mess with or dip into the blood vessels. They slow heart rate and contractility. Examples would be verapamil and diltiazem. These are great for arrhythmias, especially atrial fibrillation. But the caveat here is that we can't use them in patients with heart blocks or heart failure. Why avoid these in patients with heart blocks? These calcium channel blockers slow conduction through the AV node. That's great for atrial fibrillation, but dangerous if the patient already has a conduction delay, like first, second, or third degree AV block. Why is this a problem? Heart blocks mean the signal from the atria to the ventricles is already delayed or blocked. Adding a calcium channel blocker can worsen the block or even cause a complete heart block, where the signal doesn't get through at all. So, what is the nursing takeaway here? Avoid non-dihydropyridines in patients with known bradycardia or heart blocks, unless they have a pacemaker to keep that electricity flowing. Now, why not use this type in patients with heart failure? Non-dihydropyridine calcium channel blockers also decrease myocardial or heart muscle contractility. In heart failure, especially systolic, with reduced ejection fraction, the heart is already weak and struggling to pump. Calcium channel blockers can make the heart pump even less effectively, worsening symptoms like fatigue, edema, and dyspnea. Okay, now for our nursing tips. These are the things you need to keep in mind when testing, taking your Inclex, and caring for your patients. We are going to monitor blood pressure because of the risk for hypertension. The same goes for heart rate, especially with verapamil and diltiazem. We are also going to monitor for edema and check those liver function tests as these drugs are metabolized by the liver. We are going to avoid grapefruit juice as it can increase drug levels. And remember, no non-dihydropyridines to patients with heart block or bradycardia. There are also some common side effects like headache, dizziness, and constipation, especially with verapamil. Here is a quick memory trick for the most tested calcium channel blockers on Inclex. Very nice drugs, verapamil, nifedipine, and diltiazem. Know these and you should be good to go. So let's recap. Calcium channel blockers are your go-to for hypertension, angina, and arrhythmias. They either chill the heart, chill the vessels, or both. And remember, no grapefruit juice unless you want a wild pharmacology roller coaster. That is calcium channel blockers, simplified. Now go out there and be the amazing and chill nurse you were meant to be. Don't forget to like, subscribe, comment, and share this video with other people in your nurse fam. And always remember, nursing is a work of heart. See you in the next video. Bye-bye.